Hello, welcome to Intune. Today's show is all about skincare, and I'm so excited to introduce you to our host, Dr. Dornisha Carter. She is a founder and medical director of Affinity Dermatology. She has won the D Magazine Best Doctor Award for 12 years in a row, and she's pretty much a local celebrity around here. Welcome to the show. I'm so glad to have you.
Thank you so much for having me. I don't know if I'm a local celebrity, but I'm blessed to be a part of the community and thankful to be able to contribute in the way that I can.
Well, you are very well respected for what you do, and you're just so great at what you do. And I'm so happy to have you so you can share with our viewers some of the things that you tell your own patients and just some recommendations and tips for all of us.
Absolutely.
Yeah.
Where do we get started? Let's talk.
Yes. So, with Intune, we talk a lot about inner health and how that affects our overall health. And so, the skin is our largest organ. So I would think that a lot of the things that are going on inside also affect how our skin looks on the outside or how our skin feels. And so, I wanted to get your thoughts on how does all of that tie in? How do things like stress and our environment and our vitamins that we take, how does all of that affect how our skin looks and feels?
Absolutely. So, I'd venture to say that, while the skin is the largest organ, I'd say it's the best organ, but maybe I'm a little bit biased. So, but of course the skin, we say the eyes are the window to the soul, but our skin really, is sometimes it's an open door, right?
Right.
And so there are a lot of different conditions on the inside, starting with just emotional, something as thoughtful is, okay, I'm having a bad day, that affects, you're maybe not smiling or you're frowning.
True.
That leads to wrinkles down the road. We also see a lot of medical conditions that affect on the outside. So we may see somebody with diabetes be at higher risk for different rashes on the legs or increased risk for different infections like folliculitis or intertrigo in the folds of the skin. And we want to make sure that we're managing these underlying conditions such that the skin can look well on the outside. And we know that just for general overall well-being, people really do place a lot of stress and a lot of, what is the word? They place a lot of value on their appearance. And it's okay. Right. It's okay. It's not just vanity, okay? Right. It's all right to say, I want to look good. We know for a fact that beautiful people, tall people, tend to get more promotions, tend to get, it makes it easier for them to find a spouse. They are treated better in society. And so our appearance, our face, our skin really is a representation of that. And it's best to put our best foot forward and take care of that as well.
Oh, I totally agree. I think that's so well said. And one of the things we talk a lot about on Intune is that feeling of empowerment and what it takes for us to feel empowered to kind of live that best version of our lives. And I know for me and a lot of our viewers, one of those things that helps us feel our best is how we present ourselves to the world. That can be different for everybody, but I think that is so important and not just vanity, as you said. So it does, seem to make sense that there's such a big connection there with our inner health and our skin. And I know for myself personally, when I haven't slept well or if I've had a really stressful week, I mean, our skin shows it too, right? Yes. So are there certain vitamins that people can take or certain things that people can change in their diet that might affect how their skin looks?
Well, the first thing I say is sometimes great skin health is not found in a bottle, it might be found in the gym. So getting out, exercising, moving your body, that can help with just getting that blood flow going, bringing that youthful tone, that undertone to your skin. So that's the first thing. And making sure that your weight and your health is kind of at an even keel, because our I see a lot of patients who they quickly lose a lot of weight, whether that's medically assisted or they are changing their diet and exercise, and then they're worried about the wrinkles and the sagging and the sallow appearance of their skin.
So are you seeing a lot of patients who have maybe been on a GLP-1 medication and have had more sudden or rapid weight loss, are you seeing a lot more wrinkles and other effects on the skin?
One thing that we know about youthful appearance is that having a reduction in volume underneath the skin, and that's the muscle, the bone, and the fat, a reduction in volume contributes to aging, right? So we use a lot of fillers. I use RHA fillers in my practice, and fillers are like squirting jelly into a donut. So we're
That's a great description.
Right. So we're trying to fill the inside, fill the under, the inside of that donut, and try to plump it up. And so we know that with patients who lose weight very quickly, their skin is not able to accommodate that reduction in weight and that reduction in volume underneath it. So thing I compare it to is a canvas that you wrap on a frame. So that frame may be very, very taut, but if the frame shrinks, the canvas is not stretched.
Right.
And so yes, we do see a lot of patients who face that. We're able to accommodate for that volume loss, whether it is natural, just aging, because it happens very naturally with
to all of
aging.
us. We change, our face change, our structure changes.
Exactly.
Yeah.
So, that reduction volume, we can add filler. We also are able to add, we may have to consult a surgeon or, we can add these things together to get patients the appearance that they're looking for.
Perfect. So that's very helpful for our viewers. And I guess, is there a transition period where their skin may just kind of adjust gradually, or is it kind of more difficult to achieve that naturally?
Well, when it comes to weight loss or, just that volume loss, losing gradually allows your skin to accommodate a little better. However, for our patients of size, it may not contract the way that they would like it to, at which point we're pulling out our lasers and we're trying to get that skin to contract for them.
And that's great to know that there are so many options.
Oh, yes.
I'm amazed by that. And that actually kind of leads me to a question I had for you about just things that are different now that you're seeing than when you first started out in practice, which you said was 2014, right?
Oh, I'm a little older than that. It came out in 2010.
2010, that's right.
Yes.
So, well, your skin does not reflect that, I'll tell you that.
Thank
you. But you have been in practice and had a lot of experience over many years. So, and I know personally for me with pediatric patients, some of the trends I was seeing when I first started practicing versus now, I mean, there are so many shifts that we see in the medical world. So are there some trends that you're seeing now or some things that have to do with how our skin looks now that is different than what you started out seeing?
Right. I think that we went through this period where, of course, you didn't want everybody to know that you were getting something done. However, there was the desire to look done. And so I think it trended towards being overdone, where you could look at someone and you can see, oh, wow, you had that's a lot of filler.
And they kind of looked the same. Everyone had the same look. And so that was a telltale sign.
Yes.
Yeah.
And then you would see people who, maybe they get lip filler. I just did lip filler this morning. So for a patient, but lip filler, it was very large and people were trying to create the keyhole right in the center. Now we're seeing this trend towards natural appearance, natural skincare, really trying to look like you are the age that you really are, because I think that sometimes trending towards trying to look too young actually gives you more age than you intended.
Yes. There is a certain beauty and grace in kind of owning who you are, including how old you are.
Absolutely.
Because our age does reflect our experience over time through our lives. And, and I'm proud of that experience over time. So I'm not trying to chase an age that I've already passed. I'm a different person now.
Now, one thing I will say to everybody is don't be afraid of a little Botox. A little bit of filler is okay. You don't have to lay down and just accept it. Right? So if you want to make a change, my job when you walk in the doors for you to say, hey, Dr. Carter, these are the things that I would like to change. And my job is to tell you, one, whether it can be done, and two, if it can be done, and three, most important, if it should be done. So you do want the person who will tell you no, that's probably not a good
Absolutely.
idea, but you don't have to lay down and take it. And we can do things in a way that is very copacetic and very sympathetic to
Right.
your natural structure.
Yeah. And I think you very much have an art for that with what you do. It's you can kind of see what the patient desires and still keep some guardrails in place because that's your job.
Yes.
You know, you wouldn't be doing your job if you didn't kind of tell your patients what your professional opinion was if they were going too far. So I think your patients appreciate that. And, you know, you mentioned Botox, don't be afraid of it. And, you know, I think one of the things that surprised me to learn was that it's often a preventative, you know, option for people who are kind of getting to that age. Maybe they're not super concerned about their wrinkles yet, but they're like, hey, I just want to do everything I can to kind of preserve and feel my best. And so is that something that you sometimes recommend to your patients?
Oh, absolutely. So I kind of think of those Hair Club for Men commercials from years and years ago where, you know, the owner is like, well, I'm not only the owner, but I'm a client too.
Yes.
And so I am happy to tell people, yes, I have Botox all over my face. So, but I'm still expressive.
Yeah.
I think people are afraid that they're not going to be able to smile. They're not going to be able to give their kids the look, right? 'Cause
My
I'm a
kids
mom.
need to know.
They need to know that I'm not happy with
We need
them.
to see the change in expression.
Exactly. So, you know, they need to know that it can be done in a very cosmetically pleasing way. So, but I've had all the things. I've had the filler, I've had the microneedling and the Botox and the filler. I've tried a little bit of everything. And I think that speaks to not only my experience, but also what I'm able to offer to patients. So I'm not just walking in and recommending something off of the shelf. I can say, this is my experience as a provider, as a physician, and this is that prescribes it or recommends it, and this is my experience as somebody who has received it myself.
Well, and that's so helpful because looking at you, I'd be like, you just don't understand. You can't understand what I'm dealing with. How could you know?
Oh, come on now. Has everybody seen her? My goal is here.
Well, same.
Absolutely beautiful.
But that does also show that you feel comfortable using all of these treatments on
absolutely.
yourself. And so you're not going to recommend something to your patient that you don't trust yourself. And I love that.
Absolutely.
Yeah. Well, you know, a lot of things out there. There's so many products. Even in the pediatric world, sometimes I would feel bad for my patients being like, you guys must be overwhelmed because there's too many choices.
Right.
When it comes to things like skincare, it is overwhelming. I almost feel like I need a word of mouth recommendation or a physician recommended product. But do you see people kind of wasting their money a lot? Are there things that you see people doing? For a while, like people were putting snail goo on their face. And I mean, there's all kinds of trends. And I mean, I've tried some of those, so myself included. But are there things that you see that you're just like, ooh, I wish people just knew to stay away from that?
I think there are a couple of principles that everybody can apply to their skincare choices. First off, keep it super simple, the KISS principle. Keep it super simple. I have patients who, upon my own request, I'm like, bring me your products. Let me look through them. And they will have duplicate products, multiple things that have the same active ingredient. I have patients who just have an overwhelming number of things that they need to do each day. And I had one lady bring in a cling for her mirror for the bathroom, and the cling had about 13 steps that she was supposed to complete twice a day.
Wow.
I'm like, I can't even keep up with that. So keep it super simple.
I love that.
The next thing is you have to stick with whatever product that you're going to use. So if you're going to pick a regimen, at least try it out for a good month, maybe 2 months before you discard it. Number 3 is seek out help when you need it. So at some point, the things that you're using over the counter, they're probably just not enough. Now, when you're organizing your regimen, I would say you start out with 4 things. You need sunscreen. Everybody needs sunscreen.
It took me a while to convince myself that I also needed sunscreen because when I was a kid, we just didn't do that.
Same.
I went out and played all day and didn't worry about it. But as I've gotten older, and especially after going through medical school and training, I have learned that I need sunscreen. Everybody needs sunscreen.
Absolutely.
For a lot of reasons.
Yes,
Yeah.
sunscreen, it's a low bar. So get yourself a fine sunscreen. If you have pigmentary issues, get one with a tint that will not only hide the imperfections that you see, but it will also help block blue light. We know that blue light, that's your TV, your phone, your computer, your iPad, even the fluorescent lights at work. That light can influence the melanocytes to make more color. So you want to get your sunscreen on each day, whether it's sunny outside, whether it's raining, whether it's snowing, all of the things. Just make it part of your regimen.
Yeah.
The second thing to add in is a good moisturizer. Now, some people are able to find a moisturizer that is incorporated with their sunscreen. Others, because of the other things that they're doing or just the nature of their skin, they need an extra moisturizer. I recommend hyaluronic acid. You mentioned snail mucin, and I am a texture and just a mindset person, and I just don't want to know that I have snails on my face. I think it's not harmful, but it's hard for me to reconcile it. So I would say most people would do just fine with getting hyaluronic acid, which is naturally
great.
present in our skin and in our joints.
Great. I love that.
Yes.
I love that. And so it's like, we're going to see a lot of trends, and some of them may be beneficial.
Oh, yeah.
But talk to your dermatologist. Keep your routine simple. I love that advice.
Yes, and so we have our sunscreen or moisturizer. Now we need our retinol and our good cleanser. So retinol it's hard to say what's the strength of a retinol when you look at one over the counter, but pick a good brand and stick with it. Use it in the evenings because it does get inactivated by the sun. But get your retinol on board, and that moisturizer, that might be where things come in handy because retinols can dry you out just a little bit. If you have something like acne or discoloration, a prescription retinol may be necessary. And then a great cleanser, brightening up the skin. Alpha hydroxy acid is superb at doing this. And so you can find a great cleanser that is not irritating, that you can use maybe in the shower. Just make sure that you have your sunscreen, moisturizer, retinol, and good cleanser on a daily basis. And really, that's the foundation of great skin. All the extra stuff, okay, we'll add that in if we need it.
Yes.
But start there.
4 things. I can handle 4 things. 13, not so much, but 4, we can do that. Well, this has been so helpful to have you talk about all things skin today. If you had one last kind of bit of advice to share with our viewers, like just one pearl that you've picked up in your practice and your experience, what would you want our viewers to know?
I would want your viewers to know that I want them to be patient and forgiving of themselves. All too often I see patients who are chasing an ideal that really isn't fair to them. If you are 64, you can't look like a 24-year-old unless you're Kris Jenner. I don't know how that happened. But I have my suspicions there. But be very, very careful of the information that you trust. When we look at things on the internet, you want to make sure that you are looking at somebody who is credentialed, knows what they're talking about. It's very easy to start up an Instagram account or a YouTube channel and start making videos. A lot of the things that you see when it comes on your feed, it's there because it has garnered views.
Yes.
But it doesn't necessarily mean that the advice is sound.
Yes.
It doesn't mean that the picture that you see reflected back at you hasn't been modified. They're telling you use 13 things, this is the way my skin looks, but in fact, they have a filter on.
Yes.
And so I would say just watch what you trust.
Yes.
Follow physicians, follow people who have that knowledge to help you get to where you want to be. And be forgiving of yourself, be loving of yourself. My goal is to help you love the reflection in the mirror, and I can do that.
I love that. Thank you, Dr. Carter. You have given us some amazing tips for our skin. We so appreciate you sharing your expertise with us.
Thank you for having me.
Of course. And I'm sure a lot of our viewers will want to know how to reach you, how to get more of your great advice. Is there a way that they can contact you or find you?
Absolutely. So my practice is Affinity Dermatology, located in Frisco, Texas, just north of the Dallas-Fort Worth Metroplex. And you can find me online at affinitydermatology.com or my socials handle, I have several, at Dallas Skin Doc Also at Affinity Derm. And you can find me on TikTok, Instagram, Facebook, and we would love to have anybody who needs a little help with their skin.
Perfect. So Affinity Dermatology, I think I'm going to be checking out your website myself. So maybe I'll see you there. Thank you so much for joining us, and we look forward to seeing you guys next time.